This is St. Louis on the Air from St. Louis Public Radio. I'm Elaine Cha. When war is happening far away, even the most detailed media reports don't capture the depth and degree of suffering experienced by people, not governments, states, or non-state actors, but everyday civilians trying to survive war. There's a gulf that exists between here and there. St. Louis doctor Amjad Musleh certainly felt that distance. So to close the gap between his ER and ICU skills and Palestinians in desperate need of medical care, Amjad recently took a trip to Gaza. And he joins us now to share what he saw and experienced and how it speaks to the human spirit. Amjad, welcome to St. Louis on the Air.
Thank you for having me, Elaine.
Before we proceed, I'd like just to note that, Amjad, you have joined us to speak for yourself, not on behalf of your employer. So, the decision to leave your home and your family in St. Louis to go into an active war zone that could not have been an easy one. Why did you decide to go?
Yeah, it all goes back to, I guess, my mom and my dad, really, like the way they raised me. The main thing that my mother ingrained in us when we were kids is one of the main purposes you were put on this earth is to serve others and do it in the way that you best can. So fortunately, I was given, training in emergency medicine. I'm an ICU physician as well. And I also speak Arabic, and I understand the culture in that area. So I felt like if I didn't do anything, I wouldn't know what to say to myself in the future, I guess, and say to my children while something was happening. And I could help, and I didn't do it. I felt like that would be a burden I couldn't handle, and I had to go out of my way and do it.
What was the process, Amjad, of signing up and getting to Gaza like?
We went in through the World Health Organization. I signed up through Society of Critical Care Medicine. There was something on their website that connected to a non-governmental organization called Palestinian American Medical Association. So I signed up for that, and then I got a call back, and I was told that I'm way far on the list, very, very far down on the list. But they looked at my language skills and my background, and next thing I know, I got a call sooner that I was bumped up on the list. Mm-hmm. We had a large medical team that was planning on going in, and that shrunk. People on our team were denied entry for one reason or another. Anyone that had any ties to Palestinian passports, or not passports, I don't know the right word, but it's like some documentation that says they're Palestinian. So those people were denied entry. So our team shriveled down to we were over 10, and we ended up with 3 people coming in.
So talk with us, Amjad, about your first day in Gaza. What was it like? What do you remember seeing, feeling, smelling? So
you enter through the West Bank, through a UN convoy, and you go to an area called Kerem Abu-Satem. Now, if you imagine the Gaza Strip, think the southeast corner of it, there's a little entrance. It's a whole fenced-off area, and there's only few entrances in it. So Rafah has closed. That was the one that was in the south. Now you have this crossing up in the north called Eretz, and then this other one where the medical teams come in from the southeast. So it's called Kerem Abu-Satem. You drive in, and the first thing you see when you enter is basically this like large fence. It's a massive wall, not a fence, a wall with barbed wire fencing and turrets, and it's just it's almost like from a movie, like a sci-fi movie. Mm-hmm. If you haven't experienced that, like if you've watched post-apocalyptic films and stuff like that. So you enter through that security zone, and then you move out of these buses that are rented by the UN, and you go into these UN armored vehicles, these convoys. And we're driving through this street. The first thing you get is this whiff of chemicals. I don't know how to describe it. It almost smells like fireworks, but this just everywhere permeates in the air. Mm-hmm. And part of it's that the vehicles are having to burn this like sesame seed oil to drive, or vegetable-based oils. And then part of it is that there is all these munitions that are being dumped into the area. So you get this just sense of smell that usually you get this olfactory fatigue. The smell goes away. But this one, it just permeates. It's always there. The next thing you sense is, as we're driving through, you feel these kind of like seismic activities. So there's these sounds and the windows shake. Sounds and windows shake. And some of that, they said, is sonic booms, just airplanes going really fast. But a lot of it was not. It was just explosions in the distance.
Right.
And so when I asked, is that near? Like, I felt my first shake in the cars, and they're like, no, that's pretty far. And I was surprised by the gravity of how far something could be, send that kind of force towards you. The other thing you sense is, as you're driving, you see all these destroyed buildings. It's just these shells or husks of buildings. It's every street you're on, every single street, it's rubble. It's pure rubble. There's wastewater is just draining, and people just walking through it. And it's just pure destruction. We finally arrived to the UN safe house, they call it, and it's on the beach. This is where the safe zone is supposed to be, where most people are in their tents. And to call it a tent is not a camping tent. It's made out of people found plastic, and it's what a little kid's clubhouse, what little kids would gather scraps and put together, and that's what people call tents.
So you mentioned wastewater, Amjad. And one of the basics of survival is water, the kind that is safe to drink, and for the medical work that you were going to do that is safe to use with patients. Was such water available anywhere?
So the safe water is hard to come by, basically. One of the problems that they have is the water treatment plants are they're not available. I don't know what the situation exactly is, but people don't have access to a lot of bottled water or actually safely treated water. The first thing I sensed when I was in the guest house or the safe house, I was just getting ready to do our daily prayers, and we clean ourselves as Muslims right before, and one of them is to wash your mouth. And I remember just this, I went under the sink, I put it in my mouth, and this is the UN guest house. This is what threw me off. The saltiest water I've ever tasted, it was like gargling salt water. So I was like, it was a stunning, it hit me. I didn't know how to describe it. It was a shock, kind of. I was like, this is supposedly this UN safe house. They have the best access to everything. And it seems like they're using salt water or partially treated ocean water or something. It didn't make sense.
Yeah.
So that if that's the best water that we're getting, I don't know. Well, I do know. The people were telling me what they were drinking, and it's basically they were boiling their water, and they were trying their best to keep it clean and find the tankers of water. People were trying to clamor around tankers of water.
Let's talk about the healthcare system. There were 36 functional hospitals in Gaza prior to the start of the war last October, and as of July, only about 13 functional hospitals remained, according to a UN agency. Since the Israeli military began bombarding Gaza, its forces have destroyed entire hospitals, struck ambulances, and killed and detained hundreds of healthcare workers. Amjad, tell us about the hospital you were stationed at.
So the hospital I'm stationed at is called Nasser Hospital. So Nasser Hospital is, per the health ministry people that were there, that kind of set us up and showed us around and credentialed us and said we were good to go, is the biggest hospital left that's actually almost fully functional compared to the past.
What does fully functional mean?
That means you're able to do neurosurgery. How about that? You're able to do complex medical procedures.
Sure.
And when I say that, I say that with quotations marks. Like when I say neurosurgery, they don't have a craniotomy saw. They don't have a way to do the proper procedures. But they supposedly have all the services that a main hospital would have.
Okay.
Now, it's an understatement when you say partially functional. We are talking about, compared to the U.S. standards, extremely limited resources. I'm talking about putting Band-Aids on people and giving you blood pressure medicine.
Okay.
So when this hospital at least is capable of doing surgical procedures, the rest are really just patch you up and hope for the best and send you off to these big hospitals.
Right. Even the number of patients that you were seeing in Gaza, how did that number compare to what you would be doing or what you are doing here in St. Louis at Barnes-Jewish?
Yeah, an ER doctor is supposed to probably, like a good ER doctor, there's debate. Some say 2 patients an hour or something of that nature, or some brag that they can see 3 an hour. But the more you see, the less your quality of work is. Mm-hmm. Just the less time you see, less time you spend with a patient. But over there, the patients come in waves, and the need is immense. So this ER only has probably 20 medical beds, a 6-bed resuscitation bay, and a 4-bed injury bay. So not many beds, but they're seeing 1,100 to 1,700 patients a day. And they're not simple cases. These people don't have access to water. They don't have access to food or sanitary food, sanitary water. So anyone with chronic medical conditions are pouring in. I haven't even touched base on the trauma yet. This is just the chronic medical conditions. So think your 50-year-old with diabetes. Think your little kid with diabetes as well. There's no refrigerators. There's no insulin management. People with anyone with high blood pressure has progressed to chronic kidney disease. So the amount of medical patients was overwhelming. I think especially the fact that we didn't have computers. All the computers were destroyed in the hospital. That this hospital was invaded before, and all the medical equipment was kind of destroyed. So our laboratory is very limited, mm-hmm. and our capability of diagnostics is very limited. There's one CT scanner serving this whole massive population. There's probably 2 ultrasounds in the whole hospital, and just very, very limited capabilities. But the people there are just work nonstop. It shows you the best of humanity, the worst of humanity, and the best of humanity at the same time. You're seeing some of the most horrific things, and you're seeing people bowing together and work their hardest to do what they can with the limited resources they can.
We're speaking with Dr. Amjad Musleh, an emergency care doctor and ICU physician at Barnes-Jewish Hospital, who recently came back from a medical trip to Gaza. You did mention these chronic conditions that you were needing to treat. As far as the trauma cases, and I ask this question also understanding that trauma porn is very real, and the extent to which you feel comfortable describing the kind of trauma that you were seeing, what is it that people were coming in with?
Yeah, the trauma is just it's really unfathomable to describe it, because I work at a busy trauma center, and I trained in a busy trauma center, and I've trained in another busy trauma center, and I've just seen a lot of trauma. And this is at a different level. So we've seen car accidents, I've seen gunshot wounds and stuff like that, but I've never experienced the amount of crush injuries and the shrapnel injuries and the burns to this level. So most of our patients that came in and that were survivable, I guess, the thought was basically that these injuries are so devastating, how could anyone survive them? So most of just people's limbs were dismembered. And just thinking about that, just it gives me pause. Just in the moment, you zone out and you start working. So you throw tourniquets on limbs that are gone.
Yeah.
You intubate patients because they can't breathe because their lungs are burnt. Their skin is burnt, so you cover them with what you can just to maintain heat. And the medical staff and nurses are amazing. The nurses are just something else. I love nurses. They here in the U.S., they're some of the best people you've ever met, and they can do amazing. They do the magic. The nurses do the actual work.
Right.
So they put IVs in these patients that you're like, how on earth did you get an IV on this patient?
Right,
there's no
right.
skin. There's nothing. And they get the IVs. And fortunately, we had saline and we had some limited access to blood, and we were able to resuscitate patients. But I also worked in the ICU where I got these patients later on with these same injuries, and we had to further resuscitate them. The problem is there's no air conditioning. There's no cleaning supplies. So chlorine-based cleaning supplies, which are like your bread and butter, don't exist because they're not allowed into the area. The gloves, we didn't have enough sterile gloves. So there was flies in the ICU. There's flies in the ER. The people that survived gave me a sense of dread, just to see that if this patient survives, he's missing 3 limbs. And it's just the first one that pops in my mind is this 8-year-old girl, and she's intubated. We have her deeply sedated with propofol. It's not a pain medicine; it's a sedative. And she's upstairs. She needs a chest tube now. And I remember asking for the equipment to put in a chest tube, and we didn't have the sterile supplies. They just gave me a scalpel blade with no handle, and I was able to barely. It's just an accident waiting to happen, and we found some iodine, and we were able to put in this chest tube and stop her from dying today. But a week later, as you can expect, there's no antibiotic, or the antibiotics are just, there's no cultures. There's no way to know what you're treating. And so the antibiotics have been left in the sun. You don't know if they're effective. Patients died of sepsis and died later on. So we almost felt sometimes that we were prolonging misery.
Sure. Children are bearing the brunt of this war. The United Nations Office of the High Commissioner for Human Rights reports that nearly 15,000 children in Gaza have been killed since October 7th. Amjad, you have 3 young kids. It must have been incredibly difficult to treat children with the kinds of injuries that have resulted from Israeli airstrikes. How did you get through that?
I think the main thing you worry about is, just like you said, you have your own children and you think how they have access to the best food, the best water, the best my kids can get whatever they want, whenever they want. And so your goal becomes making this child comfortable. I wasn't trained as a pediatric ICU doctor. I fortunately had amazing training at St. Louis Children's. I did get a few rotations in there with the pediatric ICU, but a lot of my ICU patients were children. And the majority of the time, I told myself, I got to make these kids comfortable. The one thing that sticks out to you is seeing a child scared and you being a grown person and not being able to take away that fear. There's something that chokes you up about that, not being able to alleviate someone's need, and because they're missing their mom. Their mom passed away. Their dad passed away. A child that sticks in my brain right now, I just got an update about him. He was 3 months old. There was an airstrike. The whole family died. Everyone died. We tried to resuscitate them in the ER. And every single one, siblings, everyone was dying, basically. One by one. We would finish one, come back, and then the other one was passed away. And then this kid was left. And the person that was carrying him, I was like, who are you? You know, it was a guy wearing a undershirt and covered in blood. And he's like, I'm their neighbor. I'm like, did you know them for a long time? He's like, no, we just moved here because of a tent. And I was like, well, what are you going to do with this kid? And this kid's face he wouldn't open his eyes, but he was healthy. I could see his vitals. He was okay. We found out later on, I forced his eyes open, and he had some ulcerations, but they would heal. Children heal quick. He wasn't that injured. Just what we found out was the house kind of collapsed on them. And the people that they pulled out were just too far gone to resuscitate, except this baby. So he said, I don't know what to do, but I want to take this kid home, I guess, because everyone's gone. He knows everyone there, and they're all gone. He's newlywed, and he says him and his wife are going to figure it out. I just got an update that I found out there is an aunt in a distant area in Gaza Strip that they identified, and they're going to be able to get the kid to the aunt. But just if I can keep the kids comfortable, that was my main goal, just to keep them comfortable, even if there was a high chance they weren't going to survive it, just at least making that time palatable or comfortable and happy and whatnot.
We need to take a quick break. We'll be back shortly to continue this conversation. This is St. Louis on the Air on St. Louis Public Radio.
The Gateway brings you the day's news each weekday from around the St. Louis region and the state capitals in Jefferson City.
Our schools are accredited. We don't need this bill.
And Springfield.
How many more years must pass before lawmakers see time is of the essence?
I'm Abby Larico. Join me each weekday for The Gateway on the STLPR app or wherever you get podcasts.
Welcome back. We're speaking with Dr. Amjad Musleh, an emergency care doctor and ICU physician at Barnes Jewish Hospital, who recently came back from a medical trip to Gaza. Amjad, for you and the other medical servants who were there, Palestinian medical teams, students that you were working with, how did you all cope, and find the wherewithal to do your jobs under such terrible conditions? I mean, what was it like to go back to the UN safe house? What were the conversations you had or didn't have?
Yeah. So I actually got my accommodations actually so once you get to the UN Safe House, they send you to your location. My accommodations were in the hospital. They actually gave me the physical therapy room. There's no more physical therapists. Me and a pediatric ICU physician from Jordan were staying in that. And I would call this 5-star accommodations, by the way. Like compared to the rest of Gaza, we had a bathroom and we had a closed door. No air conditioning, no like wind circulation or anything like that, but we had a bathroom and we had running water compared to the rest of Gaza that's living with no access to that. The thing about the medical teams, the beauty of it is I feel like, again, it brings these tragedies. People think that people go against each other and start survival of the fittest. But what I saw isn't that. And I think I like to look at humanity's best nature. Mm-hmm. And I think that the worst situations bring out the best in us. These people aren't getting paid. The nurses are not getting paid. The doctors are not getting paid. The medical students, they have no chance of going to residencies. There is no residency. The whole system's destroyed. Mm-hmm. But they get a sense of camaraderie and a sense of, I am helping my community by being here. And that morale boost just makes the team so strong. It really gives you that energy in the morning, like the power to go on. The best thing I saw is the second you hear the shaking in the windows. So every time there's an airstrike, you hear the whole hospital shakes. 30 minutes later, you're going to get a rush of a massive amount of patients, more than you can handle. Mm-hmm. You're not going to be able to handle it. But trauma surgery comes down, orthopedics comes down, the neurosurgery teams come down, the ICU teams send out their people. Like everyone, the dermatologist would show up. Mm-hmm. And we joke in medicine that dermatology, there's no emergencies, but these people would all show up. Everyone has some basic training, and they're ready to help whatever they can. And so there's a sense of camaraderie that you basically, every specialty starts training each other in their own specialty. The surgeons were teaching the medical doctors, and the medical doctors teaching the surgeons, and back and forth. It was amazing.
Mm-hmm. So after all of that, you come to your last day. How did you feel?
Our last day was a surprise. I told you I was supposed to be there for 4 weeks. Mm-hmm. We got told that we were leaving earlier, actually. So my last day, it was bittersweet. I went and I made sure I gave out every item I had. I brought a water filter with me, and I made sure that went away. I had a sleeping bag. I made sure that went away. I had a pillow. I made sure that went away. So we had some cooking items and never got to use those, but all that stuff got distributed. So I gave my goodbyes, and that was bittersweet. I made these long-lasting connections with people I talk to till now, and to say goodbye to them, knowing that I'm going to be able to get a great meal and have an air conditioner blowing on me. If there's like a survivor guilt almost,
Sure.
Even though I've not seen 10% or 1% of what they've been through, but just there's this sense of shared humanity that you develop with people, and that was probably one of the saddest things to do is to leave those people behind.
And you've been in contact with some of those people from your
Yeah.
trip, if you've just mentioned. What are they telling you about how things have been since you left?
A few hours after we left, the courtyard of in front of the hospital, there was a building that got bombed right there, right as we left. So an airstrike hit that area. There's almost no internet there, by the way. Like, it's just there was one window where I could put my phone at a certain angle and get good signal or any signal at all. But people use that area to send out. But I got a video of like a burning fire kind of like right next to the hospital. I was just shocked. They were like, that's a few hours after you left. So I just, the sad part is we left and things have not gotten better. They've gotten worse. The generators are on their last legs. The supplies are getting worse. They're dwindling. There's just the situation seems more dire. They're sending me cases to ask people to present them, to ask people for help. There's just a lot of patients, and they need help. People need help.
You've been back in St. Louis for a couple weeks now. Is there an anecdote, Amjad, that you've found yourself sharing? Something that's been helping people like your medical colleagues or friends or neighbors, but some kind of story that you've been sharing to help them understand more about the situation in Gaza than they might get through news media in particular?
There's probably two. I think like that I talk about, we'll start with a happy one.
Sure.
This is something I am so thankful for Barnes Jewish Hospital and Washington University for training me and teaching me about it. There's lack of blood over there and lack of resources. So one night we ran out of the universal donor of blood, O. Fortunately, Gaza, just like St. Louis, has a very similar distribution of A, B, and O. And then in St. Louis, we use for males A positive blood because there's a lack of O. Over there, they would just not give any blood. They would never do it. And so I was able to bring in a new protocol kind of into the hospital that for male patients or elderly female patients that are not childbearing age, you can use this other blood. 85% of the population will do okay with it. And even the ones that might be reactive to it, they're going to have minimal reactions to it. And so that was something that we were able to do and has saved some lives. So that's something I want like other doctors to know. You can go there with no resources and you can make a difference. The story of kind of the opposite side, the thing that I want to like point out to people is what you see on the media right now is probably 10% of what you're really seeing. The amount of destruction, there's no schools. I can't emphasize how this is not a problem that's going to end tomorrow. There is no waste treatment. This is not a problem that's going to end tomorrow. There's more rubble than you can ever imagine. The building infrastructure has been destroyed. This is going to take years.
So, Amjad, there is sometimes a tendency for media outlets to present the kind of work that you've done in a particular way, to paint you as a hero. And part of the reason you had hesitation about speaking publicly about what you saw and experienced is that. Why is it that you ultimately made the choice to come and talk with us about what you've shared?
Yeah, I was extremely apprehensive about coming on, sharing this story. Basically, I don't even have a social media outpost in my life. I'm a very not very online person.
An analog person?
Yeah, I'm very analog, I guess is the right term. One of the tenets of my faith is doing things for good intentions and not for people to say, oh my God, he did something amazing or he did something good. So I'm embarrassed to say, but most of my colleagues don't know that I've went here. I tried to hide it from my parents before I went. I just trying to keep my intentions just for the service of the mission. But after seeing what I saw there, I felt like if I was quiet and I didn't share people's story, I would be doing him a disservice. I felt like these people kind of put their trust in me, and they said, tell this story. Please go out there and tell this story. We're just like you. We want to live. We want to eat. We want to drink. We want to hang out with our family, and we want to take care of our siblings and our neighbors and stuff like that. And we don't have that. And we're no different than you. And I felt like the St. Louis community would beautifully mesh with the people over there. Like, we are just humans. At the end of there's a whole Maslow's hierarchy of needs and everything. But at the end of the day, people just want to take care of their family. And if I didn't tell their story, that maybe this story will help motivate people to say, yes, there's some strong emotional sentiments, and there's a lot of politics in the background, but forget all that. I just want to focus on moving things forward and coming to a common ground and helping people in the future. Because at the end of the day, I really think humanity is good.
Many people, when they travel, there are things that they bring back with them. And clearly there are lessons, there are memories that you've brought home to St. Louis. Are there any items that you brought back with you, not necessarily as souvenirs, but as things to help keep you connected to the experience that you had in Gaza?
Elaine, you actually brought back one of the most beautiful memories I have from the area. You just put a smile on my face. How about that? My second day there, I met the fieriest hospitalist. She was a elderly lady. A hospitalist means internal medicine physician that works in the hospital. And this lady has forgotten more medicine than I've learned, like so much experience. And she was not happy with some of the medical management to my style of care, and was arguing about her patient. And we came to common grounds at the end of that. And I knew this lady this is a mover and a shaker. So I immediately, when I brought my items, that one suitcase that I was allowed, I specifically picked the items that would be very worthwhile to donate and give out, like a big water filter and stuff like that. So things that were very targeted. This was my key. That lady, that doctor, she basically was able to connect me to people in the refugee camps and get the items to whoever needed it. This person hasn't been paid in 10 months. They are not doing well. They've moved multiple times. And she went out of her way and bought my wife a beautiful dress from the local population, and also gave her a book and some tiny little trinkets for my children. This is someone that has like almost no money, like they're barely surviving.
Right.
And went out of her way to make sure, and she took none of the donations were for her. The last day I did make sure she got my nice stethoscope. That was my secret way. I left it with one of the ICU doctors over there, and they got it to her, and she sent me a fiery message. Don't you dare ever give me anything. She's just too proud.
Yeah.
But she took it. She said I took it, and she was happy. But just this, she didn't have to buy my wife a dress. She didn't have, and so just the humanity of it. The people have this generosity about them. The thing I wasn't able to take away, I found a way to get. People don't want your money. They don't want your donations. But there was a little girl collecting seashells, and I said, I'll pay you some money. So it was a huge amount of money, but I was like, I'll buy these seashells off of you. And she gave me a bag of seashells I was going to take back to my daughters, and that got taken away from me at the checkpoint. So that made me sad. But I did get to take that dress, and my wife loves it. So just it's an everlasting. It reminds me every time I see it.
Amjad, thank you so much for talking with us and bringing us a little bit of what maybe many of us are not seeing.
Thank you.
Today's segment was produced by Aula Kuziz.
Audio engineering and podcast design by Aaron Dorr.
Our executive producer is Alex Hoyer.
St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here.
Do you find yourself regularly listening to episodes of St. Louis on the Air? Suggest us to a friend you think might enjoy our conversations, and leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help people discover our show. Thank you.
St. Louis Public Radio is a member-supported service of the University of Missouri St. Louis.